There are about 1 billion people in India who live in what we call as Bharat or the emerging India, and they're all dependent on public healthcare infrastructure, and majority of them don't have doctors.
What are your long-term goals?
We believe in the next 4 to 5 years we'll become one of the largest primary healthcare player when we'll be operating across 16 circles.
The one book or resource that every healthcare entrepreneur should read.
Go on the ground, read the patient journey. There is no substitute to that. No book will teach you.
Imagine having access to world-class healthcare right at your fingertips, regardless of where you live. That's exactly what CureBay is doing, bridging the healthcare gap between urban and rural India. I'm Avni Raja, and on Startup to Scale Up today, I'm being joined by Priyadarshi Mohapatra, founder and CEO of CureBay. Priyadarshi, pleasure to have you on the show. Thank you so much for joining in. But before I come to you and we start our conversation, let's give our viewers a quick peek into how CureBay is transforming rural healthcare systems.
Sure.
India faces a significant gap in access to quality medical services, especially in remote areas. And health tech startup CureBay is on a mission to change that. Founded in 2021 by Priyadarshi Mohapatra, Shobhan Mahapatra, and Sanjay Swain, CureBay combines technology, skilled personnel, and strategic partnerships to streamline healthcare delivery. With over 100 eclinics in Odisha and Chhattisgarh, they've already provided accessible healthcare to more than 1 lakh patients, proving that quality care can reach everyone, no matter where they are. So, Priyadarshi, the COVID pandemic really put the spotlight on healthcare infrastructure in India, perhaps one of the most pressing issues for our country. But for you personally, from co-founding a jewelry startup to now health tech, it's been quite the journey. If you can take us through what the trigger was for starting CureBay.
All right, Avni, first and foremost, thank you so much for having me on the show. I'd love to share the story of how CureBay started with the audience. So this was during the first phase of pandemic. I was with Google those days, based out of Gurgaon. And this was a time when there was a complete lockdown. Even, the drivers, security guards were not coming home. And I had a little bit of health concern at home. Um, there was a private hospital which was supposed to contact me. I had reached out to them through my network, and just before the call, somebody asked me for my Skype ID. And I used to head the consumer business for Microsoft. I don't have a Skype ID, and that sort of got me thinking that living in a highly networked place, personally, I'm having some of the best connects. If this is what I'm going through, what's happening to the rest of the country? Right? And the thesis then started building on the fact that a lot of investment in healthcare in India has actually happened in world-class infrastructure in state capitals and the top 8 cities, at most catering to about 300, 350 million people. And there are about 1 billion people in India who live in what we call as Bharat or the emerging India, and they're all dependent on public healthcare infrastructure, and majority of them don't have doctors. And that sort of was a big trigger for me to look at, how do we solve for it.
Right. So digital healthcare is still in the nascent stages as far as India is concerned. So how would you describe CureBay's business model to somebody who's still unfamiliar with health tech platforms?
Yes, I think I truly believe that tech can play a major role in healthcare, and healthcare has not been one of the segments which has really adopted technology the way it should have. So, what we have tried to do at CureBay is to ensure that the problems that exist, like WHO has very clearly called for a ratio of 1:1,000 for a doctor to patient. In It should be like a standard, and if you look at a country like India and specifically at public healthcare infrastructure, uh, the ratio is like abysmally low, right? And we can't solve for some of these problems by just opening more medical colleges and producing more doctors. So technology has to be leveraged. Now, CureBay has created a very smart platform which is hybrid in nature. So the human touch, which is very essential in healthcare, is taken care on one end. And at the same time, we leverage technology to ensure the healthcare ecosystem can participate in this opportunity real time and deliver their outcomes to people living in far off and remote locations. So we've leveraged technology really to build the supply side first, which can connect on the platform, and ensure then that the demand side, which is living in remote area, is able to get a full stack healthcare delivered to them at their doorstep.
Right. So, from a patient perspective, if I'm somebody who is in a place where perhaps there's not that great healthcare infrastructure and I have an emergency, how will the whole process work for me?
So let me give you two scenarios, right? How does the patient journey work in an urban area and contrast it with how CureBay is bringing it to a remote area, right? If you and I go and try to meet a doctor in an urban area, we take an appointment, then somebody who's assisting the doctor meets us, understands our healthcare requirements, prepares what is called as a preclinical note before we meet the doctor. And then the doctor meets us, understands, gives us a prescription, and then advises us for certain call to action that we do. What happens in situations where there are no doctors, remote villages, is people walk into our CureBay clinic, which we have at their doorstep. We have trained healthcare workers who are present there who understand their concern, leverage technology to capture the vitals and data, and create digitally a preclinical note. And then they go to a room where they meet a doctor, but now the doctor is digitally available, not physically. And while the doctor is consulting with the patient, our staff sit right next to the patient and assist the doctor remotely in some of the processes, like doing an auscultation remotely, taking a blood sugar, making a lipid profile. And because it's an integrated platform, everything is visible to the doctor. So the doctor can see the data real time live and then sort of consult just like they would have consulted in a physical environment. So we've sort of got the human touch with our people present there. We've got the technology to capture the data, and we have enabled the process in a very innovative way for the doctor-patient interaction. Now, in case of an emergency, we really don't look at emergency cases to be solved there, but what we do, we immediately connect the patient with our partner hospitals, which in the network, we ensure that an ambulance reaches to them and a given tact so that there is no delay, and a concierge service available for them when they reach the city to help them handle them just like the family doctor and get them the necessary medical attention. So that's sort of how the CureBay model works.
Right. So the last mile coverage typically is always something that poses a challenge to any company, really, whether it's in terms of the infrastructure, the cost, the resources. How are you overcoming that challenge? And perhaps in this case more so because it's changing a habit and getting people onto the digital ecosystem.
Yeah, no, very, very, valid and pertinent observation. People specifically in rural India, they don't proactively seek healthcare. They, typically come to you for healthcare when the condition is either acute or chronic. So what we have tried to do is, while we have created a network of clinics in the remote area, every clinic of ours has also connected the community with us. So we have created a concept called Swasthamitras, where Swasthamitras are people from the community who are powered by our technology and are linked with our clinic. So they can take some of the services that we deliver at the clinic right to the doorstep of people. So that gives the trust and credibility for people. And once we connect the people there, we try and ensure that we slowly educate them to move them towards preventive, which is a massive behavior change. We have created an interesting program around that, which is a CureBay membership, where it's a subscription based model where for a very small amount, like 399 rupees a year, they get fully covered for all doctor consultations, unlimited specialist consultations, a lot of pathological tests, almost 40 parameters free of cost, and other services they can consume at a very discounted price. So we're trying to change that habit slowly and steadily, to not just wait for a condition to be acute, but move towards preventive. So it's a comprehensive way of connecting the community, leveraging technology, creating an interesting product that sort of addresses their need, and bring all this to them in a very high quality and accessible manner.
Right. So is it fair then to say that CureBay is trying to find that balance between social impact and a for-profit organization?
Well, I must say that to start with, we are a model based on dignity of care. So we don't offer anything free. It's a commercial model, it's a for profit model. And we were very clear that this has to be a profitable model, because it has to generate profits to attract funds from the market for people to come and invest in us. And that's the only way the model can scale and really become replicable to solve this problem at large. Otherwise, if you offer free services and all, you're always dependent on grants or somebody's a charity to sort of develop the model. While we are in a very, very profitable manner creating this access, yes, the problem that we are solving is creating massive impact on the ground. So yeah, I would agree with you that it's a very attractive commercial model, which is at the same time has a significant impact on the lives of people that we are serving.
Right. So, can you take us through what your revenue streams are at this point?
See, at CureBay, people can get all kind of services that they would get in a regular polyclinic. So, if you need tertiary help through our partner network, we provide that. You can get diagnostic tests done there. You can procure medicines from us. You can consult with doctors, both GPs as well as specialist consultations we can bring. And on top of all of this, we offer you the innovative product, which is the CureBay membership, that sort of keeps track of your health and ensures that we slowly and steadily move you towards preventive. And each of these revenue service line has a revenue associated with it.
Right. In terms of funding, what have been the biggest challenges, if any, when you've gone out to raise money for this kind of a venture?
So it is very important that attract the right kind of aligned capital for solving this kind of a problem. People have to believe in the customer segment that you are targeting and believe that this segment can be served in a profitable manner. So we've been very lucky in that manner to have Elevar, which is one of the marquee funds, to back us in our journey so far. And yes, that partnership has really paved the way because we both believe in the customer segment. We both believe in the approach of creating a model which is commercially attractive as well as is creating impact on the ground, and hence has been a pretty strong bond for over the last 2.5 years.
Yes. Another important aspect, obviously, would be creating awareness about such a platform, and like you also pointing out earlier, gaining that trust of the consumer. How are you tackling on both these fronts?
Let me come to the part two of your question because that's a more important one to address. Trust in healthcare is extremely important because it's not the technology, it's not the processes, it's not the clinics that you establish, but the trust which finally brings you the customer. And most of the time, rural people have seen that there have been urban experiments on them. People have come, done some camps, done some models, and then disappeared. The fact that we open CureBay clinics, which are permanent in nature, and we are there for them when they need us, is the first element of trust that we build with them. So, our biggest branding, if you say, is a clinic per se when we open them. The fact that they're there are two people present there all the time, and anytime people can need them, they can avail services, works extremely in our favor. The second thing which helps us bring trust is this whole connect the community program through our Swasthya Mitra or digital franchises, because we were very clear from day one that if you have to solve healthcare in remote area in a meaningful way, it can't be just done by clinical processes or technology. You've got to get the community involved, and by creating this Swasthya Mitra network, we've got the community connected, so people come to us through people they know. And both these elements works in a very, very strong way in helping build the trust for us.
Right. So now, obviously, there's a bigger focus on healthcare since the pandemic, especially. Healthcare spends as a percentage of GDP has gone up, although it's still below the global average. There are other schemes and initiatives by the government. But do you think enough is being done, especially as far as preventive healthcare is concerned?
I don't know how to honestly define enough because the gap is massive, and I think I welcome all the initiatives that have been taken. I think India, for the complex structure that we have, uh, the physical healthcare distribution network that the government has built itself is commendable, right? The challenge has been, how do you put a provider in every location, and that's what interesting models like CureBay are trying to sort of pave a playbook by creating this hybrid approach. Then on top of that, health is a state subject, so we have very, very strong health program for people both either at the state level, or we have Ayushman Bharat program at the national level. So a lot of initiatives have been taken. It's not easy to solve this for a complex and a massive scale that India presents in terms of challenge, but I think as a country we have been very proactive, progressive on what we are doing. The recent announcements that you would have seen about the Abha initiative,
Yes.
creating the unique health ID through Asha, are all going to go a long way in sort of getting the ecosystem connected, ensuring that patients' records and data are available, data portability is done in a very compliant manner. All this will go towards solving it. But is that enough? I think we got to build more such initiatives for a longer period of time before we really start seeing the impact on the ground.
Right. So let me put it in another way. Do you think as a country we're prepared for another health emergency or a pandemic compared to what we were during the COVID times?
I think we are one thing that I would say, which is a very, very strong sort of takeaway after the last COVID initiative, is we are not going to be caught unaware. we've now sort of, not just the government, but I think on the private side, on the startup side, we've built enough and more IPs. We have built very, very interesting medtech devices today, which can be taken to the remote locations, extremely cost effective. And all this will go in a long way in ensuring that we are not caught unaware. Like, we sort of, not just India, I think globally, everybody sort of got stumped when it happened for the first time. We have had our lessons. We have learned from the scars, and as a country and as an ecosystem, we are definitely better prepared to handle this.
For CureBay, what are your long-term goals? Where do you see the platform really in the next 5 years? And what do you see as your path to profitability?
See, we are on a very strong path to profitability. So we are already at a contribution margin level. At a company level, we broke even almost like 6 or 7 months back. Our circles, which is how we run our P&L, and circles are a concept of a cluster of 50 clinics that we operate on. Our first circle is just about to break even at an operating EBITDA level. We believe in the next 4 to 5 years, we'll become one of the largest primary healthcare player when we'll be operating across 16 circles and meaningfully solving healthcare for a few million people at the same time, being a very profitable company. So yeah, I think it's a steady path that we're looking at growing, but we're going in a very steady way. We are going in a density model. So every state that we are going, we are opening, 150 to 200 clinics and in a meaningful way, solving on the way.
All right. Priyadarshi, let me now come to you for a quick rapid fire segment. So, very quick answers. Describe CureBay in 3 words.
Access, affordability, and high quality.
Okay. The one thing that needs to be done on priority to boost India's healthcare systems.
More awareness and connected ecosystem.
Okay. The one book or resource that every healthcare entrepreneur should read.
Go on the ground, read the patient journey. There is no substitute to that. No book will teach you.
And the biggest challenge that you faced in your startup journey.
Changing the mindset on both the sides. One, of the patient trying to seek healthcare in a proactive way. It's a complete mindset change. And on the second side, to build a business like this, you need to attract aligned capital. So investors believing in this segment and believing to back this segment.
All right, we'll leave it there, Priyadarshi. Thank you so much for taking the time out and speaking to us. Wishing you all the best.
Absolutely, my pleasure. Thank you so much for having me on the show. Thanks.